What's up, guys? It's KiwiFresh, and today we're going to be playing a certain game that a lot of you have probably heard of. This game is an ingrown toenail surgery simulator, and that picture looks so gross. Like, I'm nervous to play this already, but I'm excited as well because I like it. Let's get started. Before you scrub in, the surgery may contain graphic procedures inappropriate for children or squeamish adults. Okay. We are neither, so let's go. Start. And it's not working. Oh, I hate my life. Okay. Surgery Squad. Oh, I'm so excited.
Hello, and welcome to Surgery Squad's virtual ingrown toenail removal.
Thank you.
I'm Dr. Jeff, and I will be guiding you through this procedure today.
Perfect!
An ingrown toenail
God.
happens when the edge of the toenail grows down and into the flesh of the toe. When this occurs, there is usually a moderate amount of pain, redness, and swelling around the toenail. An ingrown toenail is usually caused when extra pressure is applied to the toe due to shoes that are too tight or too loose.
Oh my
Improperly
God.
trimmed toenails, foot or toe deformities, injuries, and fungal issues can also be contributing factors. There are some ways to treat an ingrown toenail at home to relieve some of the pain. But remember that you should never attempt to remove an ingrown toenail yourself.
Stop.
If you're a diabetic and have an ingrown toenail, it is recommended that you go to the doctor immediately. Now that you understand the causes of an ingrown toenail, let's put on our gloves and remove one.
Yay.
Our patient is ready,
Oh
so
my.
let's begin by disinfecting the toe.
Ooh. Are you kidding me?
Now, we need to numb the toe with a local anesthetic. We'll have to inject the anesthetic in several locations around the toe.
I didn't do anything. I was supposed to do... Oh, God. Okay, whatever. Oh, the noise! Stop! Oh, my God! Ah! Inject it! Oh, my God.
Great. Now we'll wait a few minutes for the toe to get numb. Now that our patient's toe is numb, place the special tourniquet around the toe.
No!
This will help reduce the amount of blood coming from the wound. Once you've done that, we can move on to removing the ingrown portion of the toenail.
How do I do that? Oh my God.
First, carefully slide one blade of the nail anvil under the affected nail.
No!
We're going to go down the nail until we feel a little bit of resistance. Our patient's going to feel some pressure as we cut away the ingrown nail.
No! Stop! Oh my God! Oh my God! That noise! Stop it!
Great. Take the forceps and carefully remove the ingrown nail.
Oh my God. Oh my God.
It's getting kind of messy in there. Let's clean up that blood.
I can't do this.
See that small bit of pale yellow substance right there?
Pus?
It looks like the patient has a bit of infection in the toe.
Oh God.
Firmly squeeze the edge of the toe to get as much of that infection out as you can.
No! Stop! Oh my God. Oh my God.
That toe is starting to look much better, but we're not done yet. Next, we're going to apply some phenyl acid to the wound. This will help ensure that the problem of ingrowth will not reoccur in this toe.
Look how tiny his toe is! His toenail!
When you're done inserting the acid, I'll remove the tourniquet and we'll finish up.
Stop! That toenail will like never grow back. Oh my God.
Finish by applying some antibiotic ointment on a sterile gauze pad.
Okay. Oh.
Place it against the toe and wrap it in a gauze bandage.
Oh my God.
Fantastic job.
No.
Since there was some obvious infection, our patient will be sent home with a prescription for some antibiotics. We'll also need to tell our patient to keep the wound dry, clean the wound regularly, and replace the bandage 2 to 3 times a day.
No.
While our patient's toenail isn't likely to regrow, His condition is likely to return if he doesn't take care of his feet. This includes wearing proper fitting shoes, properly trimming his toenails, and keeping his feet clean and dry. And that's how we remove an ingrown toenail. You did a great job today. While you're here, try your hand at one of our other surgeries here at surgerysquad.com.
Oh my god. No. I'm gonna find another one. Let's find one. Okay, is there like a... I think there's an eye surgery. Let's see this. Let's look it up. Lasik Eye Surgery. Oh, yes, please! I'm gonna get LASIK one day. Look at the baby! Oh my god! Do it. Let's do this. Come on. Look at that! No! I'll never be a doctor, ever. Oh, who's calling me now?
By doing so, we can focus the light so that the patient's vision is improved. Our patient's already had her preliminary exam. Her prescription hasn't changed for more than a year, and she has no history of eye disease or injury. This qualifies her as a perfect candidate for the surgery. We want to make this procedure as pain-free as possible, so we'll use drops to numb the eye. Can you place a few drops into her eyes?
Look at her! That looks like you just saw like some nice booty. Okay, great. Never gonna say that again. Okay, let's go. Drop it into the eyes. Oh my... No.
Even with the numbing drops, it's possible that the patient can feel pressure and mild discomfort, but they do help with most or all the pain. Debris can complicate the procedure, so we need to make sure that the area around the eye is clean.
Get that makeup
Now
off.
that the area around the eye is clean, we'll use a device called a speculum to hold the eyelid open wide.
Oh god, please no.
So let's get that speculum over the eye.
No!
If the patient was allowed to blink, we might cut or burn the wrong area. At this point, we'll also mark the cornea with a water-soluble ink to guide replacement of the flap. Now we place a suction ring over the eye. The ring sucks the cornea upward, making it easier to cut. The patient's vision will likely dim and blur while the suction ring is attached. For this next step, we're going to slice open a flap on the cornea.
Oh my god.
To make the corneal flap, we use a mechanical microkeratomy. We slide it across and it cuts the top 20% of the cornea. Here we go. Slide the microkeratome along the track to create a thin flap in the cornea.
We're cutting her eye open! I love how the nurse was like, okay, let's get started. Cut it off! Ah! Oh god. Break. Click and drag the micro thingy. I did! Oh my god.
With the corneal flap cut, we remove the microkeratome and suction ring and then peel back the corneal flap to expose the middle part of the cornea.
Peel.
This is the part we'll reshape with a laser. The computer-controlled laser is positioned over the eye. By analyzing our patient's data, we've pre-programmed the laser to tell it how much corneal tissue to remove.
Please no.
A flip of the switch to fire up the laser and the reshaping process is underway. Pulses from the laser will correct the shape of the cornea in less than 60 seconds.
Oh my god.
The laser makes a slight clicking sound and you might notice a faint smell similar of burning hair. And that's it. Please fold the corneal flap back into the original position. Nicely done. While you were working, I went ahead and took care of the other eye. We will observe our patient for several minutes to assure the corneas bond correctly. The cornea is quite amazing in this respect. It will be bonded back to each eye in moments.
Oh my, that's actually
Even
really
with
cool.
the corneal flap bonded back in place, the cornea is still vulnerable and could dislodge if the patient isn't careful. That's why we put a clear protective shield over each eye.
She's a pirate!
This keeps the patient from bumping or rubbing her eyes. The patient will notice the improved vision immediately, or as soon as the numbing drops wear off. She may now be driven home as she won't be able to drive for a day or two.
Oh my god.
She'll come back within the next 48 hours so we can remove the eye shields, test her vision, and examine her eyes to make sure everything is healing up nicely. And there you have it, another successful surgery. You can see more of my superior surgical technique and my other procedures here on surgerysquad.com.
Okay, nope. Nope! Alright, that's gonna end the video here. Thank you so much if you watched this video through, and thank you if you really liked it, and please don't forget to like and subscribe and comment, because I look at those every day and it makes me happy when I see a comment on a video and I'm like, awesome. Alright, thank you so much. Have an excellent day and stay fresh. Bye!